Hi there. Welcome to the Health Analytic Insights Podcast. This podcast is all about creating a community of like-minded individuals who are passionate about the field of health informatics. I hope to share information and advice in topics such as health analytics, digital health, biomedical engineering, and data visualization in healthcare. And in exchange, I would love to hear from you, dear listener, about your experience and interest in this field. You can drop me a line at HealthAnalyticInsights@gmail.com, and this email, along with any references discussed during this podcast, will be listed in the show notes below. If this resonates with you, don't forget to follow and subscribe to this podcast, as I'll be releasing new episodes bi-weekly. So on this episode of the Health Analytic Insights Podcast, I'm excited to bring on Abiola Ayilara, who is a registered nurse and nursing informaticist and founder of My Care Assistant, a digitally enabled service provider whose purpose is to provide support for vulnerable patients. So Abiola, can you tell us a bit about your background, what got you first interested in nursing, and then how you pivoted into nursing informatics?
Oh, hi, Anada. Thank you very much. I think my love for IT started when I was in high school. I saw my auntie and my uncle who studied computer science, and I also wanted to study computer science. But at some point, due to cultural reasons and parental influence, I think I was directed towards healthcare. So my mom was of the opinion that, oh, you should study medicine or something. So I found myself studying nursing eventually. And I could remember that 10, 12, 15 years down the line, even though I studied nursing, I've always had this affinity for anything IT related. So even while I was working in the hospital, I got a part-time job to work at a health insurance company as a medical executive. So I did that for a couple of years. And then when I traveled to the UK for my degree and master's, I saw the way nurses were relating with healthcare using, IT softwares. They were using electronic health records, so we could have access to the back office and things like that. So those were the things that intrigued me to feel like there's something much more I can do than just being by the bedside. And thankfully now I was opportune to gain a scholarship to do health informatics. It was a field that first, I thought it wasn't going to be possible. I thought I wouldn't be able to, to get that. But then I realized that in this current age and time, everything it's all about innovation. It's all about artificial intelligence. It's all about using IT to improve patient health. And it's something that I really enjoy doing. So that has been my journey.
Yeah, that's so true with health informatics. There's so many different ways that technology actually just touches the field, and with all the volume of data that healthcare organizations collect on a day-to-day basis, it's going to be really exciting and interesting to see what technology can do in the future to improve healthcare. So yeah, it's really exciting field to be in right now, and I've been learning so much from it. And I actually learned a lot about you from Abiola from a nursing conference poster that I saw, and I saw that you were talking about the state of nursing informatics in Nigeria. So can you talk a bit about the challenges and barriers that nursing informaticists are facing in Nigeria in particular?
Yeah. So, from an experiential point of view, Nigerian nurses, we still use the pedagogical method of teaching. And I think it was the pandemic that actually changed everything for everyone. Well, what is still inherent is the fact that everyone is still at the primordial phase of gaining insight into the need for health informatics or even healthcare technology. So the thing is that we want to embrace this technology in our country, but the human resources is not equipped to make effective use of this technology. So that is why you see when the government put in so much money to bring in international executives to come and set up an electronic health record, for instance, and then they need to train the users on how to use it. However, for nursing, it's a problem of adoption. it's a problem of awareness. It's a problem of current need. I realized that if we don't do like a need assessment of if truly we actually need this service or we need this, innovation, how well is it going to be used for? And I also feel like the leadership of nursing as we need to embrace, technology. So because it boils down from there. So you want to change something, you want to introduce something new to an environment. You want to ensure that the leaders or the major influencers, they're able to speak to their team members and things like that. So I see the challenges in terms of policies and even the current educational system. But I believe that we are going somewhere.
Okay.
Because I know that there is a university that is currently teaching people on health and informatics. It's still at the baseline. It's not really in depth. And that is why I thought that so my organization, we're doing something called the Thegnosticator Transformation. I know we're getting there soon, but that is why we want to, to continue to sensitize the public, to sensitize, the nurses that it is possible for you to start from somewhere. Nurses need to be technologically inclined to know that healthcare is not just about bedside, not just about paper and pen. It's much more about the analytical interventions that mean insights we have into patient problems. And the nurses being the major workforce, we are more, exposed to the patients. So we know much more about what the patients need and, things like that. And when the research comes about, they come to the nurses to come and give them the data. So why would the nurses not know how to use healthcare technology? So I feel like with the moment we begin to own what we own, like we know this and we understand how it's being used, and then the value will now begin to emanate going forward.
Yeah, absolutely. When you think about user experience design in healthcare, it's really about making sure you design a product that the patient will need, not just someone coming up with a solution for somebody they haven't surveyed, they haven't understood it, but what the actual problem is. As you're saying, the nurses have firsthand experience with the patients. They know exactly what the problem is. So if they have the technology insights and they have the learnings, they can really help to create products that I think are very, very valuable. I think that we read a lot of articles where there's like clinician burnout due to the EHR. And some of the reasons stem from the EHR not really being built specifically for clinical care, more so for billing, right? So that's a different use case. So let's get right into it. You've created this nursing boot camp for nurses to learn more about informatics. So we talked a bit about why you developed it, but can you give a bit of an outline of what would be involved with the boot camp and who is the best audience for the boot camp?
Okay. Yes. So the Thegnosticator Transformation was something that was born out of my experience, So I felt like if you really want to change something, you need to bring it to people at the grassroots level. You need people to embrace the need and to understand the importance. So for the Thegnosticator Transformation, we are aimed at equipping and helping nurses to begin to develop this insight into the need for healthcare technology and the importance in the quality of patient care that is being delivered. So we are looking at training nurses on data analytics, cloud computing, data management, data science, Python, SQL, and R. So the truth is that we may not know all of that 100%, but the application, the applicability, when you were using a particular system, you need to know how that system operates. When you talk about companies developing software that is not fit for purpose. So when you have nurses that are very, educated and aware of the trend that is in healthcare technology, they can begin to inform and influence the kind of product that has been brought, into the hospitals or institutions, as the case may be. So that is why we want to, train nurses. So first of all, it's going to be free for the first part, and then I'll be giving scholarship to two students who participated very well. And that is because I've also been a product of scholarships. I know the value it brings to me, and I feel like many people felt or laid back. They don't want to do they feel they do not have the resources for their dreams. So it's good to always put it out there that there are opportunities that you can, gain. There are opportunities that can help you to improve yourself. That is why we're doing this. So I've partnered with Utiba. Utiba, it's like an information technology training institute. And they've been so wonderful. We've been doing this together for over a couple of months. And interestingly, I've got two amazing speakers. One is the head of computing, one of my senior lecturers. She's actually the head of the department. I was surprised, yes, when she started. And that is something. And also, I also have a colleague in New York who's a senior case manager. So she would also be coming along to just sensitize and encourage the participants on the need to actually improve themselves. I believe that health informatics should actually be introduced from the school, from the training institutes. Let people begin. So it's just like when you begin to train people to be a nurse midwife or a pediatric nurse or a theater nurse, then also put that, that option of what about a health informaticist? So let it start from there, because it's in the curriculum that you learn about the physiology and the anatomy. Also, you need to learn about the technical, aspect of healthcare. And I think that would actually improve the quality of health that is being delivered. And interestingly, most nurses are migrating to developed countries. So work. And in developed countries, they make good use of this technology that we're talking about. So it is actually advantageous to anyone who has a background knowledge on healthcare information systems. That would actually help them wherever they're going to. So it's a win-win situation. Wherever you go, you're valuable. You'll be valued for what you bring to the table. So that is what we're doing with the Thegnosticator Transformation. And even after then, we are thinking about, bringing it up until where we can begin to have a nurse informatics conference, things like that. So yeah, that's where we're going. And then even building an institute out of it. Yeah, the dream is so big.
Yeah, absolutely. And it's just awesome that you're providing those scholarships for students as a result of you getting that scholarship. That's great that you can give back in that area. And I totally agree with you about integrating the technology right when people start in the learning stage. I think that if you have the analytical mindset right from your training stage, then as you go into work, it really shapes your mindset on how you approach certain things and which technology you want to implement into your healthcare organization. So I totally agree that I think just starting from the very beginning in the training stages, it's really helpful for people. And along those same lines, you're currently completing your master's in healthcare analytics and AI. So why did you decide on this degree? And do you generally see clinicians becoming more interested in artificial intelligence and how they can incorporate it within their own clinical workflow?
Well, so for me, like I mentioned before, I've always loved anything, computer science, information systems, and things like that. So that was when the opportunity came. I just owned it. I have a previous master's in adult nursing with palliative care, but because I want to specialize in something, and it's so interesting that it is my youthful dream. I don't know if you get that. My youthful dream, what my desire was when I was growing up, was the same thing that came back to me several years down the line.
You can't suppress those dreams.
You understand? It was the last thing that's the thing. So even though we may have gone different ways, the path would always bring us back to our first love. So, it's always bring us back to our first love. So that would be for me. So when the opportunity came, I was like, yeah, this is the time. And that was when I knew that I'm going to specialize in this. I'm going to, promote health informatics, promote health information. I may not work in the hospital, but I would consult. I will manage. I will help to implement. Because that I love to develop. I love to build. And that is where I find myself. That's what I find myself doing currently with this. And then with clinicians owning artificial intelligence, it's actually a struggle. Because, there's this debate about artificial intelligence, replacing humans and things like that. But I feel like it's not a one size fits all thing. because you can say humans are finite or infinite, depending on where you're looking at it from. So if humans are the ones developing artificial intelligence, they are creating finite things. So humans are infinite. There would always be thoughts that will create things that will lead to actions and then creation of things. So if we say that clinicians are not really interested in AI, and it's just because they have not gotten to that level of reasoning or that level of understanding of the importance of AI in healthcare. There are lots of biases, there are lots of fear, there are lots of uncertainties. But I feel like if we look at it closely, the benefit outweighs the good, and can always choose what we want. We have the choice to make for ourselves. And thankfully, most of these things we're talking about, there are patient consent that is involved, patient privacy and confidentiality issues that are being addressed. So I know that the more research is being done, the more development in technology that is being put in place, there'll be much more, concerns to how humans actually accept it, especially those in the healthcare sector. So for me, I had a personal experience. When I had my daughter, I was it was compulsory for her to do a blood test when she was just born. And I felt like that is not fair. I don't want to know. I don't want to know. Why would you just come and tell me you're screening for newborn disorders? I'm like, excuse me, what if you find out something I never want to know about? That fear is there. But you see, on the long run, if God forbid if anything was picked up, it would have saved her life. But thankfully she was very good and it was normal. But if it were to be the other way around, at least they would have saved her life. So what would have hurt her several years down the line? It's been with the advent of genetics and genomics. See, there is a lot that AI can do, lots of benefits. But at the same time, we should not be blind to the risks that is involved in AI as well. So that's my opinion.
Yeah, I think definitely. I see AI, in my opinion, as augmenting, aiding the clinician to make better decisions because there's just so much data to wade in. But as you're saying, like the creativity of thought and creativity of ideas can only come from humans. Like AI can help to sort through the data and help to make decisions, but it the creativity and the thought comes from clinicians itself. And I also am seeing a lot of great discussions happening around how to make sure that we remove bias out of these algorithms, making sure that when we're including data sets to train these algorithms, it's a variety of people, not just one specific population that we're trying to make the predictive analytics on. So I am seeing some great conversations on how AI can actually be integrated into healthcare in a way that's not going to harm the patient. So it's great that we're starting to have these conversations about patient consent and things like that as well too.
Yeah.
So Abiola, this has been like such a great conversation, getting so much insight from you. And my last question before we finish out the interview is, what advice would you give individuals, specifically nurses, who are looking to break into the health informatics or nursing informatics field?
And excellent. Thank you for that question. So for me, I believe that the journey of 1,000 miles begins with the first step. Okay. And that means for anything you want to do in life, there is an initial thought about this is where I'm going to go. And then you begin to walk that path gradually. So for me, when I look at nurses and, the opportunities that are that are inherent in health informatics, I think it is really, really vast. It is really, 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 really vast. And there are different roles that nurses can play. So I would encourage nurses to, first of all, own themselves. They need to be true to themselves about what they want to do. So it is not just necessarily being a nurse, it is being who you are. So it's not being a nurse that is making me a health informatics person. It is being who I am. If I had studied computer science 10 years down the line, I will still be doing something related to health today.
Mm-hmm.
So it is who we are. So most of the time, most people are misdirected, and that is why I'm so driven to, help people. help them to identify their strength and be able to work effectively in it. So it took me a while to know my strength, to know where I was good at. I've been working on my weakness for so long that I neglected my strength. And the moment I realized what my strengths were, I could see myself making a lot of impact. So my take on my opinion or my advice is that anybody, whether you're a nurse or not, should own yourself, know who you are. You know who you are, you know where you want to go and what directions and what options that are available for you to take. And I would also encourage that everybody find a mentor for themselves because I believe in the power of mentoring and coaching. But we can't navigate this life alone. No one is an island of knowledge. You need to find people that can help you grow. You know, I'm thankful that I've got some wonderful people in my arsenal and they've actually helped me through my journey. And I think everyone should actually do that. And for the Thegnosticator Transformation, I believe it's a platform that will further bring together nurses in Nigeria who are willing to find a career path in health informatics. So yes, it's knowing who you are, finding a mentor for yourself, and joining a community that is aimed at helping you to grow. So those are my
That's great advice, great life advice just in general, and this has been a great interview. Thank you so much, Abiola.
Thank you, Ayilara.
Thank you for listening to the Health Analytic Insights Podcast. I'd love to hear from you about topics I should cover in future episodes. Please consider subscribing and leaving a review. Have a wonderful day.